So the Essentia Health Foundation has really been, I would say, the main team that has made our NICU happen. So we have 14 private rooms where we have family-based care, which we were not able to have before September of 2019. So without their support and everybody that worked with the foundation, we would not have this multi-million-dollar beautiful NICU, level 3 NICU.
A standard ventilator breathes for the baby. Sometimes it has some forced breaths behind it, so it can have a volume and a pressure that we're forcing into the baby. So that can cause a little bit more lung damage as well, just because of the pressures that we're putting in the lungs. So it has a set rate, a set volume, and it's just required that in a minute that baby is required to get that many breaths with this much pressure. The Nava would function differently in a sense that it would sense when the baby's going to take a breath, and then could also help decide the volume that that baby is going to get as well. So if the baby's supporting some of that breath with their own volume, it would only add so much more pressure, so it could be gentler on their lungs and timing it better for those patients.
Nava can help give control to the baby with the work of breathing. Usually the brain regulates the work of breathing in case of the Nava. So there is an electrode which is a part of the feeding tube. So there's just one feeding tube which functions as an electrode as well, which goes into the baby. And then this senses the activity of the diaphragm, and then accordingly the ventilator does the work of breathing. So it's giving control to the baby instead of us controlling the work of breathing for the baby.
I think just the newer technology, it's kind of the way ventilators are going to be going. It's better for the child, hopefully not having to be in the NICU as long if we're able to avoid intubation. If you do have to intubate, Nava can also work with an intubated patient, so it's non-invasive and invasive, but even if it is requiring invasive ventilation, it's gentler on the child, hopefully can avoid some of the damage that can sometimes be caused with positive pressure ventilation in the conventional mode.
I think that Nava would be a great addition to Essentia's NICU, just for our babies in general. I think we take care of some of the tiniest patients and they always deserve the best. So if we can decrease their stay here or provide the best technology and the best care and treatment for them, that would be ideal.
So your gifts to the Essentia Health Foundation during Giving Hearts Day will make a difference to many of our tiniest patients. Every dollar counts in reaching our goal of providing the Nava ventilator. The generous support provided for our NICU babies has a significant impact. The state-of-the-art equipment will help our babies have a gentler way of breathing, receiving respiratory support, and help protect their lungs. Please join me in contributing to the Essentia Health Foundation on Giving Hearts Day, February 10th.